Okay, it is 7 o'clock and we have 1 hour, so we're going to get this conversation started. If all the panelists could go ahead and turn your videos on. Just want to say thank you and welcome to everyone who is joining us this evening, really for this healthy conversation around just kids and learning in the time of the pandemic. Really excited to have everyone here with us. Thank you for tuning in to this conversation. My name is Luke Fedlam, and I'm the chapter president for Alpha Phi Alpha Fraternity Incorporated's Alpha Rho Lambda Chapter. Alpha Rho Lambda, as a chapter, we're celebrating our 90th year this year, and we have a long history of working and focusing on education and on youth. And so we're excited to host this conversation today, as it truly is unprecedented times and an important conversation to have. And as the chapter has focused on education for so long, I'm happy to have as a co-moderator with me, my brother, Brother Landon Adams, who is the chair of our Education Foundation. He actually went through one of our programs that works with young people called Alpha Esquires. I won't say the number of years ago that he participated in that program, since he is my friend and I want him to remain my friend, but he went through the program, and it's awesome to have him now chairing our Education Foundation. Brother Adams.
Yeah, Brother Fedlam, thanks for having us this evening. Again, Alpha Rho Lambda Education Foundation has actually been serving the Central Ohio community for 40 years now. We've given over $250,000 worth of scholarships time, and also have provided additional Alpha programming. Again, our Alpha Esquire program, we help support the Project Alpha that we do, and a variety of programs just like this that are addressing the needs of education in our community, not just for Black boys, but for children of all demographics in our community. So we're excited to be co-hosting this program again this evening.
So we have to say first, welcome to our panelists, Dr. Mashika Roberts, Brother Melvin Brown. Thank you all so much for being here and helping us work through some of these questions and some of these challenges that we're all facing during this time, especially as it relates to our children. So you all can Google and find out a ton of information about both of these wonderful panelists. So I'm not going to just read their bios to you, but I do want to share some highlights so you understand the context through which they're presenting their perspectives. Dr. Mashika Roberts first, she's the health commissioner for the city of Columbus, and she leads the Columbus Public Health Organization and a team of nearly 500 public health professionals who are all focused on neighborhood-based approaches that address the social determinants of health, from safety to affordable housing and education to jobs and violent crime, really in order to decrease the health disparities that exist. Dr. Roberts' time over the past 5 or 6 months clearly has been so focused on COVID-19 and dealing with really leading our city through this time. She has a prolific 18-year public health background at the local, state, and national levels. And just by way of background, she got her MD from the University of Maryland School of Medicine and her master's in public health from the University of Michigan. So thank you, Dr. Roberts, for joining us today. And now, Brother Melvin Brown. I have to start off by saying brother, as he's a member of Alpha Phi Alpha Fraternity Incorporated, our Alpha Rho Lambda chapter here. And so Mr. Brown is the superintendent of Reynoldsburg City Schools. In this capacity, he serves as the chief executive and administrator officer for the district. He reports directly to the Board of Education and has all the executive administrative powers and duties that are in connection with the overall operation of the schools. He also exercises his leadership through school administrators who comprise his leadership team. He has over 21 years of school administrative experience working in various parts of the country. He holds a master's degree in educational administration and supervision from Virginia Commonwealth University, and a bachelor's degree in English from James Madison University. And he's currently working on his doctorate in educational studies, educational administration at The Ohio State University. So to you, Brother Brown, thank you so much for being here as well.
My pleasure, thank you.
We also want to give a thank you to all of you who are joining us for this very important conversation, whether this is for your information or sharing it out with those in your network. Again, such an important conversation for us and the health of our children as it relates to their educational endeavors. We do want to remind you that we'll have this kind of moderated discussion between Brother Fedlam and I, and Dr. Mashika Roberts and Brother Brown for about 30 minutes, and then we'll open it up to our Q&A function. So if you look down at the bottom of your screen, there should be a Q&A button that you can press to send us your questions, and we will take those at that time. If you've got one now, you can go ahead and put that in the queue or anytime throughout the discussion. And we're going to go ahead and just jump right in. Dr. Roberts, first question to you. Can you just kind of give us a pulse of kind of where we're at right now today? We know things have been changing and moving and grooving, and who knows what it might be come the morning time. But, you know, at this time, as we start this conversation, where are we from your seat as our health commissioner?
Sure. Well, thanks again for having me this evening. I really am, honored to be here and to provide some insight to your listening audience and to your members about where we are with COVID-19 here in Columbus and in Franklin County. I remember the day clearly. It was March 13th when I got the call from the Ohio Department of Health that we had our first confirmed case of COVID-19 here in Columbus. Fast forward to today, we have 13,625 cases of COVID-19 in just 4.5 months, almost 5 months, I guess, at this point. That is a remarkable number, but it's not just a number. Those are individuals who've been affected by this virus, and some of them are still suffering from some of the sequelae or some of the symptoms. They're not just going away immediately. And unfortunately, we have lost almost 400 individuals, 399 in our community from this virus. And those are 400 families who no longer have their mother, their father, their brother, their sister, or their grandparents, their aunt and uncles, their neighbors, or their coworkers. So this is impacting our community. And this isn't just some random virus that's out there that maybe affects some people. It affects a lot of people, and we need to keep that in mind. We also know that this virus has had an unnecessary burden on people of color. Here in the Columbus area, people of color, that's brown and Black people, make up about 40% of our population, yet they represent 60% of our cases. And especially if you look at hospitalizations, they represent, again, 60 or more percent of our hospitalizations. Unfortunately, that shouldn't be surprising because we also know that our Black and brown community also are disproportionately affected by chronic diseases like diabetes, heart disease, and lung disease. Individuals with those chronic conditions are known with this disease to have increased complications. Those increased complications cause them to get admitted to the hospital. So I just want to set the stage there in terms of what this virus has done. There's some information out there that maybe this virus is not impacting children. It is impacting children. If you look at data that we have at Columbus Public Health, just from March to June, so take those 4 months, we had about 870 cases between the ages of 0 and 19 years of age. If you fast forward to the month of July, we had 990 cases. So in 4 months, we had 870 cases. And in 1 month, we had 990 cases in that age group. And the majority in that age group, the 0 to 19 group, were 15 to 19-year-olds. So again, this is a virus that can affect anybody. And, we put some measures in place. We had a stay-at-home order for several weeks. That helped us flatten the curve. And then when we reopened, I think many of us did not adapt behaviors appropriately, knowing that we were still in this pandemic. And that's when we really started to see our cases surge. Just from June 15th until July 15th, our case count increased by 220%. And we saw a lot of people having graduation parties, 4th of July parties, small family gatherings, and that was just a recipe to spread the virus. So some of the measures we put in place more recently to try to control the spread of this virus are the mandatory mask order. Our Mayor Ginther, put that in place on July 3rd. We are starting to see that impact and starting to see now our cases go down. You probably heard that the city also passed legislation to close bars or stop serving alcohol at 10 and close bars at 11. Unfortunately, we were taken to court on that, and now we have a restraining order, so we can't enact our legislation. But fortunately, the governor had the Liquor Control Commission vote, and they decided to stop selling alcohol around the state at 10, and it had to be consumed by 11. That is in place right now, although they were taken to court on that issue today. But we know that alcohol and bars are a perfect spreader for this virus. Columbus was listed as one of 11 cities to watch for a surge in cases. We were visited by Dr. Deborah Birx, who is the coordinator of the White House Coronavirus Task Force, and she was very clear with us that if Ohio doesn't make some changes soon and make some aggressive measures, we could be the next Florida, Texas, or Arizona, or even California. And so she told us we needed to do three things. One is she said we needed a mandatory mask order. When she came and told us that, we already had that statewide mask order in place, so that was a good thing. She also told us that we needed to close bars or limit the hours that bars operate. We now have that in place. And then the other thing she told us we needed to do is really limit our social gatherings to 10 or less. And when we have those social gatherings, we should try not to serve food so that that ensures that people can keep their mask on the whole time. So that just gives you a preview of kind of what I'm dealing with on a daily basis at my health department, and how this virus has affected our community as a whole.
Yeah, thank you. Thank you for sharing that. That's it's sobering when you hear all the statistics, but it's necessary when we think about the behaviors that we need to adopt. So thank you for sharing that. Brother Brown, a kind of same type of question in terms of setting the stage for us. When schools closed around spring break earlier this year, there really was this thought that, okay, well, it'll be an extended spring break. We'll be back in school before the year is over. And here we are now, right? And I know so much has happened even in the Central Ohio schools over the last week. What has it been like from your perspective, planning and preparing for the education of young people in your district?
Thank you. First, let me please thank Dr. Roberts for the work she's been doing with our group of superintendents in Central Ohio to make sure we can prepare. She's been talking with us almost weekly to provide us with updates and keep us on our toes and doing the things that are going to be responsible in terms of whatever a reopening could look like. March 13th was a watershed moment for everybody. That was the day that we heard the information. That's the day that we communicated information to our community. And our kids didn't return after that day. We had some foresight in our district. We began looking at the possibility of this happening about 3 weeks earlier. So we began to plan some curriculum and some online portals and activities that we could put in place last minute, but still we had a little bit of a head start in that regard. All of that kicked off the following week when our kids were at home. And for many, I think we got off to a really good start. Our staff did a wonderful job of shifting their mentality and their methodology on a daily basis. But it's taxing. It's a brand new way of learning. It's a brand new way of teaching. And I know from my undergrad experience, when I went through my teaching program, no one taught me how to do that. Those are things we had to put together while the plane was in the air. So we reflected on what the spring was. We anticipated that we would not be coming back toward the end of the year. Last year, I was pretty confident we were going to shut our doors and continue to do remote learning throughout the course of the year. So we immediately began planning for this upcoming year. Our teachers gathered for some professional development early in June and began to talk about more intently what online learning could be and increasing their capacity. Lots of things were taking place in terms of revamping our curriculum, being able to deliver it through a varied numbers of internet portals, and basically having a conversation about, we have to understand this is a really strong possibility we're not going to come back in the fall. Because I think there was a lot of thought that, oh yeah, after this school year, everything's fine. We'll come back in August and everything will be perfect. We knew that was going to be a possibility. So we tried to prepare for that. Since then, we've done a couple of things in putting together our responsible restart plan. We used the color-coded system that the state developed to help us frame what that could look like, the levels that are associated with that, and instituted how we would come back based on the levels and a number of other parameters that we were going to use as data points. Some of those would include absenteeism, numbers of cases that were in our community, numbers of cases within our county, looking at the availability of drivers for our buses and things of that nature. So there were a lot of pieces we're going to determine when we were going to shift. We initially announced we were going to start in a hybrid mode. I think that went out, if I remember correctly, about 3 weeks ago. That's kind of where we were at that time. When the health department came forward last week and talked to us about the need to, they recommended us coming in a remote fashion. I'm not one who's going to say, forget about the health department. I'm not going to follow that. No, that's not going to be me. we're gonna follow those orders, take that recommendation and that knowledge, because despite how much education some of us may have, I am not a medical doctor. I don't know what that should look like, and don't feel that I'm the appropriate person to be making those determinations. So on Thursday of last week, we announced at that point that we were going to start in a remote fashion, and we began planning. We backed our school calendar up. We initially were going to open after Labor Day. Opening in a remote fashion allowed us to move our calendar up a little bit, so we're opening on August 24th, and we'll do 1 week of professional development with our teachers on August 17th, and things will kick off right after that with our kids coming indoors virtually on August 24th. I think something that's important we mentioned in the midst of dealing with all of this, we also are instituting some practices to combat racial and social inequalities within our school district and within education in general. So there's work being done there as well. I know a lot of the focus obviously has been on our preparation for COVID-19 for obvious reasons. But at the same time, know that school districts are also combating those types of things within their own institutions to tear down some of those barriers that prevent kids from accessing education in the best possible way. So quite a bit of work is being done right now.
Dr. Roberts, kind of to that point, as Brother Brown brought up, that not only are there the issues with virtual learning, but there are other issues that kind of compound that: access for students, racial inequalities that already exist. From a public health perspective, we think like students have been kind of locked up in the house for this last 4 to 5 months, and now starting this school year where social interaction, social learning, and all those things are really a part of kind of both the human development and the educational experience. What are some of the other things that we should be aware of or be thinking about as students are entering, again, another kind of virtual learning experience? What are they losing, missing, that we might want to watch or pay attention to?
Yeah, that's a great question. So I think most of us know that so many of our kids get so much from school, far beyond just the education. And many of our schools, our kids are getting 2 meals a day, that they really rely on those 2 meals. They're getting breakfast and lunch. They're getting another adult who can lay eyes on them to make sure that there's no physical harm being done to them. They get socialization, which we talked about, that they might not get at home depending on who they live with. They get some physical activity. That's important as well. We know that makes a well-rounded child if they have some physical activity. It also helps them learn better. So for some of them, they might get speech therapy. I mean, there's a lot of different services that we funnel through our school. And so when I put out the recommendations to the school districts, I was not naive to understand that some of our kids were going to miss out on some really important items that they need, the least of which is food. I mean, food, if you really think about that, particularly in large districts like Columbus City Schools, I mean, so many of our kids depend on that, and the families depend on them getting 2 meals a day at school. So now we send them home, and where's the family going to get the resources to purchase that food? So it's a challenge. And I know so many districts have stepped up and figured out a way to at least meet some of that need, whether it's the food need, whether it's the emotional support, some of the social support, but it's hard. But I would also say losing a loved one as a result of getting COVID-19 or bringing COVID-19 home is also hard.
Yeah. So Brother Brown, along those points, then, when you think about what Dr. Roberts brought up about the additional services, right? Access to technology, right, is obviously important, right? So, and sometimes it's whether or not they have access to a laptop or computer. And I know that there are a lot of Chromebooks that districts have, right? But what about access to connecting to the internet, right? And we've constantly kind of thought about the digital divide. So what is your district, and as you talk with other superintendents, what are people doing what are school districts doing to make sure that those services are provided, both the technology, but then also some of the other services that Dr. Roberts mentioned around the emotional support services, the food, etc.
Sure. I'll start by saying anybody who's watching this, and even people who may watch this later on, I think it's important to advocate for the whole notion that internet connectivity is a necessity in 2020. In this world we live in, to not have that, we are depriving people of information. And to me, that's a huge inequity that has to be addressed. And we need to be able to put in parameters that allow us to make that a reality for everyone. One of the things we did with our district, we initially sent home Chromebooks. The parents were able to check out Chromebooks in the spring, so the kids were able to access, to have a computer in front of them. And if they had connectivity, obviously in their homes, they were good. So we also did a couple of things with our Wi-Fi access within our schools. We boosted their signals a little more so they could go a little bit further, have a further span, and people would be able to access a little more. We also took some portable Wi-Fi devices and put them on our school buses and parked them throughout the city in areas that may have been a little more remote and less easily accessible, so that parents would be able to go there, or kids could go there on their bikes or walk or what have you, and be able to access the internet. Something we're doing right now for this upcoming school year is we're talking with one internet provider that may, I'm crossing my fingers on this, and I'm hoping I know by Friday, we're looking to be able to give internet access to any family who doesn't have it and who qualify for free. That's something we're working on currently. I'm hoping that'll be able to be put in place immediately, but we have some work to do between now and the end of the week to try to get those things done. In addressing the social emotional issues, there's so many things that are crucial at school that I completely understand, and I have to be one of the first. I have to say, it's killing me that our kids aren't coming back, because I know they rely on those services. From a food standpoint, immediately back on March 13th, that following Monday, we began distributing weeks of meals to all of our kids. I think the first week, that first Monday, we gave out about 16,000 meals on that Monday, so they could have food throughout the week. And every Monday, that cycle has continued since then. We've been doing that since that time. We also did a bunch of well checks throughout the school year in the spring, so that our counselors, our safety and security folks, and our Reynoldsburg Police Department were able to do well checks on kids to make sure our kids were okay in many respects. So that was put in place. Something we look to do very creatively for this upcoming school year is to engage virtually with our kids so that they still have an opportunity to do those things. So we're going to be building our schedules so that there's time in each day, particularly on Wednesdays, that allow kids to have direct access with an adult who can connect with them on whatever their issues might be. We're also looking with our special education population, we're having conversations now about what does it look like if small groups of kids come into schools to get their services. Dr. Roberts mentioned speech pathology and things of that nature. Our kids need those services. So we're going to have to open our doors and allow them to come in to do those things. So we're looking at what that could look like right now. I'm pretty confident we're going to pull that off really well. And I'm excited about the whole notion of being able to service those kids and give them those resources. But the bottom line for us in education is we just have to think very differently than we have in the past. We're so accustomed to come on over to the school and everything is right here. We now have to be a little more accessible to the community and, in a sense, go out to them, albeit virtually. We have to do things incredibly different, and it requires some creative thought, some collaborative thought, and a lot of powerful minds at the table having those conversations. I'll be the first to say also, I'm not the smartest guy in the room, so I rely on those around me to keep us moving. And our team has had a lot of great ideas about how that could look. So I'm proud of the work we're doing, but we have a lot more to go.
Thank you for that. Dr. Roberts, I want to maybe talk about some of our younger children, maybe in the daycare kind of age. And from that perspective, whether it's children that are going to daycare or if there are play dates that a young child might have with neighbors or other young children, do they need to wear masks? How do you get a 5-year-old, a 3-year-old, or what have you to physically be distant from each other? What thoughts do you have from that perspective for some of our youngest children?
Yeah, so first of all, masks should not be put on anyone under the age of 2. And CDC is very clear about that. And the mask order we have here in Columbus says anyone under the age of 6 does not have to wear a mask. So keep those ages in mind. When we look at our data here locally, you know, we've had what we call pandemic daycares, and they've been open for some time. They had to get special qualifications and meet certain rules. And the numbers of cases that we've gotten from those pandemic daycares have been really low. So the measures that they put in place to protect not only the staff, but the students, the kids, have worked. And so we're hoping that moving forward, as daycares start to open, if they follow the state guidelines, we think they'll be effective in keeping the numbers down. I'm not saying we won't have cases from daycares, because we will. We have. And that will continue. And it's really hard to tell a 2 or a 3-year-old to social distance from their playmate. I mean, that's nearly impossible to do. For all of you who've had children, have children, you know, that's very challenging to do. So the best we can do is clean the surfaces, limit the number of things that they could possibly put in their mouth, and things of that nature that could be a mechanism or a vector to spread the virus. When we think they're age appropriate, to put a mask on them if they can tolerate it, and do a lot of thorough cleaning, and really limit the adults that are coming in to care for them, the number of adults, and make sure we have a very thorough screening process so that sick adults don't come to the classroom, and adults do need to wear a mask. Masks are very effective in reducing the spread of this virus. So if the adult wears a mask, that will help the children.
We are going to ask one last question for you, Brother Brown, and then we will move to Q&A. We've got some questions that have come in. If you have a question either for Dr. Roberts or Brother Brown, please use the Q&A button at the bottom to submit your question. But Brother Brown, a question for you. How are you and your colleagues working to be supportive to parents who are trying to figure out, am I homeschooling my child? What is this? You know, we've got our oldest daughter will start kindergarten this year, and I don't know if it's better that she's not had kind of formal education or if that's harder. What kind of resources are there for parents or even folks in the community who are supporting our students in these online virtual environments?
One of the first things we decided we were going to do, regardless of how we return to school, was to develop our own virtual academy so that parents who either had children who were not able to come to school for medical reasons or what have you, or simply because parents weren't comfortable sending them. We wanted to have it available because we want our kids to remain our kids, and we want to be able to provide resources to take care of them. So that's one of the first things we set up. Something we've been doing since then is continue to engage parents in ways, or trying to engage parents in ways that are very non-traditional. And it's going to take some work. It's very different. I think it's pretty, relationships are crucial in schools. We know that. And having face-to-face contact with kids provides you an opportunity to do that, that relationship piece. But I think you can also do that virtually. And I think we have to be very intentional about how we address kids and how we interact with kids so they have opportunities to have adults who demonstrate caring and for them and providing them with that nurturing that they need on a regular basis. There's so many different things we have to consider that are very unique and unusual as we try to navigate these spaces. But it's important that we're able to take care of those things in a very fortunate way. And for many of us, this is going to be a learning curve. I'll be honest with you. I graduated from college in 1993. Nothing that we're doing right now, I learned back then. So we are truly putting the plane together in the air and trying to rely on a lot of different minds and ideas that allow us to have some creative thought about what things could look like.
Good. First Q&A question, actually, Dr. Roberts, I'm going to pose this to you. There's a question about kind of other activities, contact sports, AAU, other things that are happening in the community where parents or individuals might feel like, well, I can't tell them no, or what am I going to do about this? Like, how do individuals and communities be responsive to places in the community that don't seem to be wearing masks, you know, aren't following social distancing? What kind of things can people do to be safe? Should people report people? Like, how do we help keep each other accountable together when people still have that as we would say in the church, good old free will.
So those are a few different questions in there, but let me take the first one about extracurricular and sports. And I'm glad we're virtual and I'm not in public, because someone might be throwing eggs at me if I was in person somewhere. So I did put out some recommendation late last week that I recommended that schools not have extracurricular activities. They also do not have sport activities. And they wait till we've seen a 4 consecutive weeks of a downward trend in cases before we have face-to-face classes or face-to-face education. And I feel strongly about that, and I still do. If we're saying our kids can't go back to the classroom to learn, we shouldn't be allowing our kids to have sports either, or not have sports, but to participate in sporting events. I realize there is a lot of learning and growth, and there's a social connection with having sports. But I also can tell you that since we opened, or since we started having practices and allowing sporting activities in the month of July, that's what largely contributed to that number. When I told you we had 870 cases and our population between 0 and 19 over a 4-month period. And in the month of July, we had 990 cases. That all had to do with summer camps, sports events, practices, and things like that happen. And so that's why I put out that recommendation. I would also say that goes for, the non-school related sports. So AAU or AUU, I'm sorry, I'm not a big sports fanatic when it comes to that age group. But they shouldn't be participating in sports activities either. And part of the rationale for that is sports, we have said, when you're exerting yourself, when you're exercising, you don't have to wear a mask. And I understand that. I wouldn't want to wear a mask if I was running down the street. So these kids are participating in sports. They're in close contact with each other, and they're not wearing a mask. Not to mention they're high-fiving each other. They're doing all those kind of things, giving each other hugs, all things that during this pandemic is just a no-no. We should not be doing. We shouldn't be shaking hands. We shouldn't be hugging people that are not in our household. It just shouldn't be happening, because that's how the virus can spread. So then you bring up the next question about when people aren't following the rules, so to speak, and some of our guidance, what can you do? If you have a complaint about a business in Columbus, you can call 614-645-1519. We generally take complaints about businesses. We can take complaints about an individual. Those are a little harder to enforce and a little harder to follow up. But when we get complaints about a business, a location, my sanitarians do go out and do site visits. We probably go on at least 5, what we call compliance checks a day. 50 compliance checks a day from complaints that we've received on that number, 614-645-1519. I know sometimes it's difficult to tell people you should wear a mask. I have, some people that I work with, we have to wear a mask in my office. I am going into the office every day. I'm not working virtually. And so we have some people who like to play with their masks all the time. They're constantly taking them off. And I have to constantly tell them, keep your mask on. And so I realize for some people, they're not comfortable, but it is what can get us over the hump. We all want to get back to some sense of normal. And the sooner we can all start doing those practices that I mentioned, so wearing the mask, keeping those social gatherings to 10 or less, trying to limit our time at the bars, washing our hands, staying home if we're sick, that sooner we'll be able to get to some sense of normalcy.
I think it's the continue to point out, as you did earlier, like, sure, we miss these things. These things are important for our development, and this is a matter of life and death. I think, if it was my own senior year, I'm a proud Northland High School graduate, and I served as the drum major for the marching band. And I can't imagine what kind of disappointment that would be, going in your senior year not to be able to do these things. But again, when you put it in the context, like, how much more devastating would it be to not be able to come out of your senior year, or for mom and dad or grandpa or any other relative or classmate not to make it out.
Right.
It's and really, I think sometimes for me that's the only thing that puts it back in perspective. But we got to say, what are we willing to risk? And when you realize what you're risking, that helps you go back and assess what your safety and protocols are going to be.
And you know, that's a question I ask myself all the time. And when people ask me, should I do this? Is it safe to do this? My response is always, is it worth getting COVID over? At the end of the day, when you go do whatever it is you want to do, if you were to get COVID 3-5 days later, would you say, well, at least that party was worth it? At least that wedding was worth it? At least, you know, that trip to the beauty salon was worth it? Would you feel that way?
Dr. Roberts, could you repeat that number again? If people have complaints, I want to put it in the chat.
Sure, it's 614-645-1519.
Excellent. So I just put that in the chat so everyone can have it there. I want to go over to Brother Brown real quick. So, and again, thank you all for submitting your questions. Please continue to submit them. We have a lot of them, and so I'm going to try to merge some questions together as well. So thinking about our young people, right? One of the questions, and we got from a couple of different people, is what parents can do to try to mimic the school day as they move, into this virtual learning model. And on top of that, how should parents, or how are you going to recommend for teachers, your teachers in your district, to help encourage parents on how to monitor their kids' progress and growth, right? So that they don't fall behind in kind of their coursework.
Sure. To address the first part with how to continue to interact on those issues, I think it's important that we're stressing we'll be stressing with teachers that it's important. You still continue to engage with parents and provide them with resources and thought processes that allow them to adapt to this new environment and doing all these new things they haven't done before. We'll be putting together a list of strategies that can assist in that regard. And at the same time, we're building what basically is a daily schedule, so to speak, at each of our levels, elementary, middle, and high school, so that there's some time frames, there's some organization to the entire day. And obviously we'll be sharing that with parents. There will also be situations where parents have to still go to work and still send kids to daycare, and they may not have access to their teachers at that time. So we want to be able to provide some recorded sessions, some off hours, perhaps the teachers could get in touch with parents. And we just have to be very, very creative about what this all looks like. I wish I had a list of everything that we're going to be doing, but I guarantee you by the time I get to the office tomorrow, I'll have new things to add to the list because it's very different and very new, and it's new for everyone. I think sometimes we tend to make the assumption that people in the industry know all the facts, and really we're learning too. We have some context in which to apply things, but a lot of those things we're learning on the fly as well.
Excellent.
Brother Brown, sticking on your side, what accommodations are there plans right now for things like music education and arts, not that are just kind of extracurricular, but are really a part of the core, you need this many credits and this diversity of classes to graduate. What's kind of on the table for accommodating those things?
When speaking in the music education in particular, we're waiting for some additional guidance from the Ohio Music Education Association as far as what that could look like in a virtual environment. Our band right now, they're still doing very limited activities. We're in stage 1 of any activities that we're doing, which means they can do conditioning, they can do marching. There are no wind instruments or anything of that nature that are being played. So that's where we are, but we're trying to work with them to get some guidance on what that could look like. In addition to that, we think art can be done fairly well in a virtual environment. It has to be done very differently, obviously, but we think that can happen. Music is a unique one, and I wish I had those answers for you today. I really don't. That's a question we continue to ask, and we're hoping to have some clarity on that between now and the end of this week, so we know what to deploy with our teachers next week. Now, the one thing I will say about our music educators in our district, those are incredible people who do some incredible things. And they probably already know how they want to address this. So I'm looking forward to connecting with our teachers on the 17th when they get back into buildings where we can actually have those conversations and be able to provide our community with an idea of what those things are going to look like. Unfortunately, there are millions of questions out there. Some of those questions can't be answered right now, and that's just how it is. I hate having to put it quite that plainly, but that is the truth. There are many things that are going to be unanswered, and we're going to find out as we address those things.
So Dr. Roberts, a couple questions have come in just to understand kind of some terminology, right, that's been out there. And one of the questions, and I'll maybe throw 2 or 3 kind of to you here, and you can kind of parse through them as you see fit. One of them is just to understand what exactly is herd immunity and what does that mean? And the other kind of theme along that line is that you know, Dr. Fauci has mentioned that the virus is going to be around for a long time, could be around for a long time. You know, kind of, I know that you can't, you know, look into a crystal ball, but you know, the question is around this idea of, do you see us potentially still wearing masks a year from now? And a question along that idea of masks was a question around young people. And you mentioned earlier in your comments around, you know, the guidelines very specific that the CDC has put out around very young children and masks. But if you think about, let's call it, you know, older than 6, you know, young teenagers, preteens, are there any issues with wearing masks, you know, all day? And should you take, you know, breaks, or should there be a place where you can then get fresh air? Any issues along that perspective?
Yeah, so some good questions. So herd immunity, how do I describe it? So we have herd immunity, for example, with chicken pox here in the United States. We have herd immunity because more than 60% of the population has either been exposed to chicken pox in their lifetime, like myself, I had chicken pox, or has been vaccinated against chicken pox. And so the more people we have who've had the disease and recovered, or who've been vaccinated with the disease, those people are now kind of immune from the virus. They have it, they shouldn't get it again. So they can protect those who aren't immune, who either haven't been vaccinated because they can't, because they have a fragile immune system, or lucked out, went through their whole childhood and never got chicken pox. We can protect them. We can kind of provide an envelope around them. So the concept of this 60 to 70% of the population are protected from a virus, then we have herd immunity. And that majority, that herd of people, can protect the minority who have not been sickened by the disease or vaccinated. So that's what herd immunity is. We are nowhere close to that here in the United States or even across the world with this virus. It's a very new virus. And although we have 13,000 cases here in Columbus, we have a population of 800,000. So although 13,000 seems like a lot, it pales in comparison to our actual population. So that's herd immunity. The next question was about Dr. Fauci and his predictions that this virus is going to be with us for some time. It is. It is going to be with us for some time. And, you know, I tell people this, if history repeats itself at all, the pandemic of 1918 lasted 2 years. So sit with that for a second. It lasted 2 years. Now, I'd like to believe our pandemic of 2020, or really COVID-19 that started in 2019, will not last 20 years, will not last 2 years, will not last 2 years because of technology. The world is very different today in 2020 than it was in 1918. And so we have technology on our side, we have science on our side, we have vaccines on our side that should make this a shorter pandemic, but it's really hard to say. So we are going to be in this situation for a while. I can't predict how long, but I do think the masks are going to be around for a while. So get your mask wardrobe together, be prepared, because we're going to be wearing masks for some time. This is not something that will end in December of this year. I anticipate this time next year, we could still be wearing masks. Will the mask order go away? Potentially, but we could still be wearing masks. We're going to be in this situation until we get some type of herd immunity, or we get more people to get vaccinated when we get an effective vaccine. And that's a win. You know, most vaccines take 3-4 years to develop. They're fast tracking this. They're trying to get it out as soon as possible. And when it's available, we don't know how many people are actually going to sign up to get the vaccine. So that's going to be an issue too. So we need to get people vaccinated when the vaccine becomes available, and we need to keep wearing our mask. And I don't have a crystal ball, I wish I did, to know when that will end, but we're going to be in this for a while. And I can't recall the last question. I'm sorry, Luke.
It was just whether young people need a break, a mask break.
Yeah. Yeah, so interesting. That was asked today at the when I spoke to the superintendents this morning, and I don't have an answer for that. I actually was looking on the CDC website to see what guidance they have about mask breaks for kids, and I haven't been able to find anything yet. So I have my team looking into that. But, I would say everyone needs a mask break. Like I said, I go into the office every day, and so I wear a mask all day. When I'm in my individual office when no one is around, I take my mask off. But as soon as someone walks into my office or I walk out of my office, I put my mask on. So yes, you do need some type of break from a mask. But how long is that? And, how frequently is that? We don't have an answer for that right now. But I would say when you're finding a mask, you should find masks that are comfortable, ones that you can wear for a period of time, and not only for you, but for kids. When we do send our kids back to school or do activities, what have you, they should wear a mask that's comfortable for them.
Dr. Roberts, follow-up around vaccines, right? And we have a long history in our community of we're not doing this again. I don't know if it's words of advice, encouragement. What do you say to particularly our community when we know this is mentally and intellectually we can say of course this is what's necessary, but then culturally we have our own rightfully earned baggage and challenges with this area. What's your kind of word of the wise or support to the community?
Yeah, so I will say vaccines are effective. More of us need to take vaccines. The uptake of flu vaccine in our community, really in our nation, is very low. We probably at best get somewhere between 30 to 40% of our population that takes the flu vaccine every year. And that's really low. And so I will just start by saying vaccines are safe. I don't know what this vaccine is going to be like. I don't know how effective it is. They say it needs to be at least 51% effective. Personally, I think it needs to be at least 70% effective for people to really want to get in line and get it. I mean, 50-50 or 50-50 or 49-51, that's kind of a gamble in my opinion. So I think it needs to be more effective than 51%. And I'm optimistic that it will be. I understand why so many in our community are reluctant for new medical technology. I get it. I grew up in a healthcare environment. My dad's a physician, my mom's a nurse. And, I remember at one point someone wanted to enter me into a clinical trial and both my parents were like, no, 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 no. And you think coming from that type of household, they would be receptive to that, but they're both from the South and they were like, no, that's not going to happen. So I think we need to read, we need to educate ourselves. We need to make sure we read things from scientists, not politicians, not people who are out there just to interrupt the scientific data that's out there. And I think based on that and talking to your healthcare provider, but if it's effective, and again, effective to me is at least 60 to 70%, I think we should strongly consider getting this vaccine. And I would be promoting people to get the vaccine.
So I just want to follow up on that real quick. And this is actually for both of you in your comments, right? Because I think this is what you just mentioned, Dr. Roberts, I think is kind of one of the quintessential aspects of COVID-19. And that is the politicization, right? And basically, making this a political issue as opposed to a scientific and medical issue. So, and there was a question that was asked as well around, what are you doing? I mean, obviously we know what you two are doing, but what can others do, right? What can people do in terms of sharing the science or sharing the technical information, the medical information, the factual information with others in the community, right? So from your particular roles, obviously you're out kind of preaching the science and preaching the medical side, but are there resources available for people to go to? Do you recommend going to the CDC's website or what are some other kind of resources that can be accessed by any of us to better educate ourselves, but also to share with those around us and take the politics out of the situation?
Yeah, so that's very frustrating for me as a public health leader, that this virus has become such a political hotbed. I mean, it really has. And, you know, hopefully I'm around safe company. And I think it really is because who lives in the White House that has happened. This virus was not man-made. This virus came from another country. And I think there were things that our country could have done sooner and faster to have prevented it from being as bad as it is today. That being said, there is great information available for the public at cdc.gov. There is great information for the public at coronavirus.ohio.gov. I would strongly encourage you to read that to get your scientific guidance and not get your scientific guidance from the White House. I also would say that, you know, the guidance that you hear Dr. Fauci say or Dr. Birx say, that's true. And the guidance that you hear me say, it's true. I don't just say what I hear. I read up on it. I make sure it's accurate, and then I share it with the public. You know, I was a big fan of masks before there was scientific data out there to show that masks were very effective. And when there was scientific data out there, it just further validated that masks are very effective at controlling the spread of this virus. And so here we are today, and we're wearing masks. But please, there's great information at cdc.gov. It's very easy to read. I think their website is easy to navigate. You might not get everything you want, but you're going to get probably 90% of what you want on that website. And coronavirus.ohio.gov also has some really good information. And if you want to know data, come to our website, columbus.gov/coronavirus. And we've got a whole bunch of data there if you want to really know the facts about what's happening here in Franklin County.
That's great.
Just to put a point on that, I mean, for me personally, I'm very fortunate in that I get to get my information directly from Dr. Roberts every week. So I stay current as much as I possibly can. And then I share that with our school board and try to put that in our communications to our community. I'm also fortunate in that we have a community that for the most part understands this science and sees the importance of doing some of these things to be responsible. I know some other districts is battling some other things. I'm just very glad to work in the district in which I do.
For the both of you, back to students and kind of them understanding or surviving quarantine and what it means for the whole world to be different. Again, not just for adults. I tell people it's like it's March 115th, right? How are children's mental health affected by this? And how can parents and other folks in the community be sensitive to it, understand it, and what might they do to be able to support students and young people's mental health challenges with the way the whole world seems to be different these days for them?
Well, I'll kind of talk globally, and then I'll pass it over to Superintendent Brown to talk about kids specifically. But I think everyone's mental health has been impacted by this pandemic. I mean, whether you are a working adult or whether you have lost your job or your hours have been drastically reduced, whether you are a teenager or whether you are a young child, your life has changed significantly. You know, for weeks when we had a stay-at-home order, you probably didn't see anyone that didn't live in your household. Maybe you saw the neighbors across the street or across the yard just waving at a distance. But, you know, most of us are social beings. So we want to be around other people and some new people, not just the same people that we live with every single day, day in and day out. And so think about the people who live alone. Think about the single mom who's trying to do all of this with 1 kid, 2 kids, maybe even 3 kids. We have seen since this pandemic started, we've seen an increase in overdose deaths. We've seen an increase in homicides. We've seen an increase in gun violence. It's been a challenge. It has been a challenge. This has hit us hard. We've seen many people who are hungry. We've seen people who are unemployed. Fortunately, because of the way some of the rules were written and the courts were closed, we haven't seen evictions. But this pandemic is hitting our community hard. And the health part of it is just one aspect of this pandemic that we have to deal with.
I think it's important that we take some cues from ourselves as adults and some of the things that we confront, no matter what our station in life. We're all battling this in one way, shape, or form. Just speaking personally, it's been incredibly stressful. The most stressful time in my entire career. And it's pushed me to my limit. So I can imagine what it's like for people who may have lost a job or dealing with a financial situation or dealing with COVID itself, just alone in that regard. As far as our kids are concerned, they're going to have some of the same types of thought processes and obstacles, but they're going to manifest potentially in different ways. And we have to be able to be keen to what some of those things are. One of the things we want to do at the beginning of the school year virtually in the first week or two is to be very purposeful about forging those relationships and having teachers get to know kids so they can pick up on some of those cues. When they see that Johnny is not interacting the way he typically does, there's got to be a reason for that. And okay, let's reach out, let's figure out what that is and see if we can address that. And it's important for parents to also recognize those signs in their kids as well and be willing to go get additional help, mental health assistance from wherever, or contacting the school and letting us know what those things are. If you're noticing something, engage in that way. This has to be something that we just don't hide in the closet and pretend it doesn't exist, because it is going to exist, and it's up to us to deal with it. Because if we don't deal with it, it's going to have some pretty drastic effects on our kids as they mature and get older.
Yeah, absolutely. So our time is winding down. I do want to ask Brother Brown, I've got one last question that's been asked that I want to pass on to you as we begin to wrap up, and that is kind of looking to the future. So obviously, your job is that planning, kind of phase, and so obviously you've got to plan for these next few weeks of moving into this remote learning. But at some point, there's going to be in-person learning. At some point, whether that's this school year, next school year, what have you, whatever that might be. So what are some of the things that you're thinking about? What are some of the issues that you're kind of spending time thinking on in terms of ensuring that students, teachers, staff are safe in returning to an in-person or some form of hybrid environment?
Yeah, from a structural standpoint, within our schools, we were prepared to do some hybrid in-person instruction. So we had all of the cleaning products that were necessary. We have a ventilation system in all of our schools that's only a year and a half old that flushes out air constantly and provides a safe environment in regard to the air quality. That was a question that some of our parents had. So that's not something we're really concerned about, because we've addressed those things even before COVID took place. We've also installed plexiglass in numbers of places so that contact with people is mitigated a little bit. I want to provide as much of a safe environment for anybody and everybody as I possibly can, understanding that we also have to take on some responsibility in that. So we're following all the orders that we get from the health department that informs us about wearing masks and washing hands and social distancing, and trying to make sure we are able to adapt to those changes. Within a hybrid model, within a classroom, you're talking about 50% of our kids in the school at a time. We're looking at how those spaces will, and although we're starting virtually, we're going to start thinking about, we've already thought about what it's going to look like in a hybrid situation when kids actually come in, and maintaining the social distance that's going to be healthy and productive. And then protecting our teachers in many regards as well, because we know adults tend to be, especially older adults, more susceptible to this, and we don't know what that contraction may look like from student to teacher or vice versa. So, it's easy to say from a political standpoint, kids need to go to school. Yes, they do. I get it. Yes, they do. But there's some pieces of that puzzle that people are kind of ignoring. There are adults in those buildings as well. Teachers aren't robots. They are real people who get real sicknesses. And we have to be very intentional about protecting their well-being as well. So from a political standpoint, I'm not really willing to have those conversations with people. I follow the science as much as I possibly can, being an English major. So I rely on Dr. Roberts in that regard, but I really won't pay much attention to that noise, because that's all I see it as.
Well, Dr. Roberts, Brother Superintendent, we appreciate you all so much, and also, do not want to take for granted or go without notice that the fact that you look like us is also important, because sometimes, even as we talked about, vaccines and how you trust, the medical establishment or professionals, to know that we've got folks who not just look like us, but are active in our communities, who are working on behalf of all of our communities, but again, look like us, give us an extra level of trust and confidence in the decisions that we're making both collectively as a community, and in the decisions we need to make personally in our homes and in our families. So we appreciate you being with us today, the work that you're doing every day, and really the exposure that you put yourself into, needing to go into the office to provide this in real-time leadership for this issue in our community. We also want to thank all of our participants who joined us, or if you are sometime in the future watching this recorded session, we are thankful that you are educating yourself, that you are participating in this conversation, because really we're not islands unto ourselves, but we are, I am because we are, right? So we are practicing good community together. I would be remiss as the chair of the Education Foundation if I did not direct you to our chapter website, alphacolumbus.com, where you can check out our work for the Alpha Lambda Education Foundation, and you too can make a donation to our work and our scholarship. Even in this work of COVID, right? It impacts the work that we do in mentoring, in education, to make sure that we're still supporting students learning in these virtual and kind of unprecedented times. So again, we thank you all for participating this evening. Brother President, for your leadership, we appreciate you and glad to be able to partner with the chapter in this effort. Absolutely.
So you can go ahead and save the date, August 25th. We're going to be looking at having another conversation. It's a Tuesday evening. Again, it'll be 1 hour, really just to talk about, okay, so we're here at remote learning. What can you do to help make sure that your kids are prepared for that transition? So look for that information coming out. On behalf of Alpha Phi Alpha Fraternity Incorporated, Alpha Rho Lambda Chapter, thank you to the panelists, and thank you all for tuning in tonight. We wish you all well, be safe, and remain healthy. Thank you.